Welcome to the Aesthetic Doctor Podcast. We don't shy away and keep secrets here. We empower you with education, telling you the truth about all things aesthetic medicine while encouraging you to be the best version of yourself. It's time to look great and feel good doing it. This is your host, mom, speaker, and board-certified physician, Dr. Borger.
Hello, friends. This is Dr. Borger, and welcome to episode 13 of the Aesthetic Doctor Podcast. Today, we're going to talk about cosmetic gynecology. Yes, friends, we're going to cover it all. And if you have never heard of cosmetic gynecology, if you've had questions about cosmetic gynecology, if you've always wanted to hear the inside scoop on what cosmetic gynecology can do on the most commonly performed procedures, this episode is for you. Our special guest and expert is my colleague and friend, Dr. Amy Brenner from Mason, Ohio. She is a board-certified OB-GYN with extensive specialty training in the field of cosmetic gynecology. She does aesthetic medicine. She does integrative medicine, and she also is a fellow podcast host. Her podcast is called HealthiHer, and she addresses all sorts of health topics that might be of interest to women, especially. So today we have a cosmetic gynecologist, Dr. Brenner. Like I said in the intro, that is so exciting. And, I think the first question that you always get asked, and for all of my listeners, like, what is a cosmetic gynecologist and what kind of stuff do you guys do?
Yeah, well, thank you so much for having me. So this has become a really popular topic. If you've studied trends in aesthetics, you know that really all aesthetic procedures have kind of gone kind of crazy with COVID, but cosmetic gynecology procedures have even really skyrocketed. And I think some of that's due to just social media. People are seeing more porn these days. Maybe some of the movies that have been out there. In general, people are just more comfortable talking about sex. Shaving kind of in the pubic area, those trends have certainly changed. And also just, I think there's been even some TV shows called like Designer Vagina and things like that. So cosmetic surgeries, along with other aesthetic procedures, are becoming really popular. But back to your question is, cosmetic GYN surgery is just a broad term that encompasses a lot of different surgeries. So that would include surgeries such as labioplasty minora, labioplasty for the majora, vaginoplasty, which is a surgery to tighten the vagina, hymenoplasty, which is typically done in certain cultures to kind of rebuild that hymenal tissue in cultures where they expect the bride to be a virgin. Some non-invasive surgeries, such as putting filler actually to puff up the labia, putting PRP into the genital area, and then lastly, clitoral hood reduction. So all of those kind of fall in the realm of cosmetic GYN procedures.
So how did you personally get interested in cosmetic gynecology? And what is the kind of training like? I know you're a board certified gynecologist, so of course that's a big commitment. That's a lot of training right there, but just tell me a little bit about your journey.
Yeah, so as you mentioned, I've been a OBGYN now for over 20 years and practiced traditional OBGYN for 11 years until I moved into this practice and started doing aesthetics about 11 years ago. And we started by just doing things with PRP like the O shot and CO2 laser for vaginal dryness. And we have a RF device for non-surgical vaginal tightening. And certainly as a gynecologist, I've always done things like, obviously with childbirth, you can have labial tears. So repairing labia either from childbirth tears or trauma straddle injuries, things like that, and also doing prolapse like Rectiseal. So it was kind of like that, but I was never trained formally, as most gynecologists aren't, to do aesthetic procedures of the vagina. And I got to be honest, I was reluctant to do it because to be good at something, it requires a lot of training. It's not something where you just simply go to a weekend course. Um, the fellowship that I did actually costs more than my daughter's first year at University of Tennessee next year. So
Wow. And congratulations to her going to college.
well, thank you. So the training was actually very expensive. The equipment was very expensive, and to be honest, I live here in Cincinnati, Ohio, and I thought, most of the people that were doing these surgeries were in California, Miami, New York, and I thought, do women in the Midwest really want to do this, or is this going to be something I learn and I'm not going to be able to use my skills? And so I debated about doing it for a really long time. And then I just decided, I'm just really interested in this. I really like doing aesthetics for the face. And so it really made sense to me as a gynecologist who also does aesthetics that it would make sense in our practice. And actually, women, I realized women are women. So whether they live in Miami or LA or the middle of nowhere, Ohio, many women are very concerned about what it looks like down there.
Yeah, I think it's wonderful. And especially that you are bringing it at such a high level of training to a patient population that probably some women in your town, before knowing about you, probably do think, oh, they have to travel all this way and they can't find somebody highly trained. Talking about the patients, what is sort of like a classic story that you hear? And I just love the fact that you're really empowering women, not to only be comfortable with how they look, but really to enhance their confidence in the bedroom, maybe in the dating world, to really let them feel all the pleasure that they want to feel. So it is really next level empowerment.
Yeah, I couldn't agree more. And I think that these kinds of surgeries in the past have kind of gotten a bad rap. ACOG, or the American College of OB-GYN, and I think it was in 2007, put out kind of a document that was really why would you do this? And why are doctors doing this? And really kind of poo-pooed women seeking this kind of treatment. But the way I look at it is it's no different than women who are opting to have the size or shape of their nose altered, the size or shape of their breast altered, possibly, a large pannus on their abdomen. They might be seeking abdominoplasty. And so a lot of women are very uncomfortable and actually self-conscious of the way it looks down there. And so most of the patients that I've been treating, or that I treat with, we'll just pick out labioplasty because that's the most common surgery for aesthetics. Is most women have been bothered with the way it looks since adolescence. And so they've come into young adulthood, have a job, have the finances, and decide that this is something they want to take care of. And so for a lot of people, it's not just about making it look better, but it's really life-changing of what it's done to their self-esteem.
Yeah. So seeing that you mentioned labioplasty, can you just give my listeners a little bit of an overview for those people who don't know what a labioplasty is, what it is, and, what are some of the reasons that people seek that out?
Yeah, so when women come to me in my practice, the first thing I like to do is give a high-level overview of what the anatomy is, because a lot of women actually don't understand the anatomy. So the outside lips, or the bigger lips, are your labia majora. Those can actually, as with really every area in our body, kind of get lax, have some wrinkles in them, become deflated, and it's typically usually with age. The most common surgery on the external genitalia is a labiaplasty minora, and those are the inner lips, the thinner lips. I used to say they're the smaller lips, but sometimes people get that doesn't go over well, because a lot of women who are seeking this procedure, their inner labia are actually bigger than their labia majora. So calling them the smaller inner lips is not actually accurate, but they're the ones that are more medial or on the inside. So that's the most common external one is making the labia minora smaller. And so the biggest reason why women choose to do this is, quite frankly, is they're not liking the way it looks. And that's why this is a procedure that is not covered by insurance. Otherwise, sometimes women say that the large labia can kind of get in the way of sexual intercourse. They don't like the way it looks in a bathing suit. In fact, I have a lot of patients that say, because of the extra bulge that it causes down there with the extra tissue, is that women will wear a couple pairs of underwear if they're wearing kind of like Lululemon pants, or wear a double bikini bottom to kind of hold everything in, or it gets uncomfortable with exercise. But because this is really not a medically necessary procedure, but more of a cosmetic procedure, it's typically done because of the cosmetic appearance of it.
You just did a wonderful job describing that, especially without a little anatomy thing, which I think in your office you probably have, and point to it. When we talk about this procedure, and, just to reiterate what I heard you say, is that almost the excess tissue that people are self-conscious of is removed. Are you doing that in an OR within your office? Do you have them go to a hospital OR? Is it an in-office procedure? What's the downtime like?
Yeah, so great question. And where I trained is we learned how to do this actually in our office. And so the benefits of doing this is it just makes it a lot logistically easier for a patient to have a procedure in our office. They don't have to not eat anything like after midnight. We actually encourage people to eat breakfast. As well as expense wise. So going to the operating room for a cosmetic procedure, it's actually been a couple years since I actually checked the prices, but the prices for the OR have just become astronomical. So it usually is going to add on several $1,000s to the cost of the procedure by doing these procedures in the operating room. So we do them in our office under local anesthesia, and we have a great pain protocol with some topical numbing cream, some inhaled nitrous oxide. Most patients actually choose to take our oral cocktail for oral sedation. Although every now and then I'll have a patient who wants to drive themselves home and feels like they have a high pain tolerance and doesn't have much anxiety. And so every once in a while I will do it without our oral cocktail of oral sedation, and just do it with topical and the nitrous oxide.
Wow. So it's just like an afternoon in the office.
Yeah.
And how long? Nothing per vagina for how long after? Like, what's the downtime? Do they have to take off time off work?
So I usually tell people with a labioplasty to plan on 2 weeks off of work or off of life. Although in reality, most people are going back to living their life after a week. But every now and then I'll just have somebody who just gets excessively swollen and they need to take off 2 weeks. So I'd rather have somebody be pleasantly surprised and go back after a week, which is typical, than be like, oh no, I was supposed to travel for work next week and what am I going to do? So most people it's a week off of work, but I like to kind of plan for the worst, and usually it works out. It's just a week, but typically nothing in the vagina, no tight jeans, horseback riding, lunging, intercourse for about 6 weeks. Usually you can go back to like light hand weights and walking after.
So sort of like after childbirth. Sounds like very similar.
Mm-hmm.
So
now with the vaginoplasty, it's going to be a little bit more than
so that was my next question. So sort of like stepping from the outside in, vaginoplasty, obviously involving now the interior structure, the inside of the vagina. Can you describe briefly what that involves?
So a vaginoplasty is meant to tighten the vagina. And so many women, typically after multiple childbirths, have noticed significant vaginal laxity and decreased sensation, either on their own, or their partner may notice some vaginal laxity. And so it can cause this genital mismatch. And so sex can be less satisfying. And so a vaginoplasty is meant to tighten the vagina. It can also fix a gaping vagina. If you're looking at somebody in the lithotomy position, kind of the position you're in for a pap smear, and if I can see into their vagina, that's called a vaginal gaping. And so a vaginoplasty can help correct that look. And so a vaginoplasty is just a little bit more involved of a surgery than labioplasty. So in that case, I do usually put a catheter in their bladder for a couple days. It tends to be a little bit more uncomfortable. So our post-procedure kind of cocktail of medications includes a nerve pill, a muscle relaxant, some pain medications. And that's going to take about 10 to 12 weeks before somebody's sexually active again.
And is that done in your office again, or is that done in the OR?
So I do that procedure in my office as well.
Wow. Wow. That is amazing. Now, does that help with any urinary kind of stress incontinence too, or is that a totally separate procedure for patients who have both of those after childbirth?
Yeah, so with a vaginoplasty, I'm going along that back wall of the vagina and opening up the back wall of the vagina and then bringing the muscles together and then getting rid of the excess skin of the vagina. So it doesn't do anything for incontinence. So that's a whole other topic.
Yes, it is a huge topic because obviously for those of you who are not in medicine, kind of the bladder sits on the opposite end. It kind of more sits on the front and up top. So I guess we already talked about recovery. We talked about these big two procedures. You mentioned insurance. And then I guess if somebody is interested and they're like, wow, I really have had these insecurities. I didn't even know this was an option. And I'm sure there's this whole like secondary almost market where women are starting maybe post-divorce or post, the childbirth years, starting to really think about themselves and their own sexual pleasure and their own lifestyle. So how would they go about finding a cosmetic gynecologist?
Well, I think, as with anything, choosing the right person to do this is very important. I know that some gynecologists, because we might think as gynecologists, like that's our body part, that's our area of the body. So sure, if you want a labioplasty, like I'll just, kind of trim it off. It is more involved than that. Certainly that there's just, kind of trimming it off is going to get rid of the excess tissue. But that's the biggest kind of risk of this procedure, is not being satisfied with the cosmetic result. Typically, what I see is either other doctors taking too much off, not making a tapered kind of end to where the clitoris or where the labia meet the clitoris at the frenulum, as well as not addressing the clitoral hood. And if you don't address the clitoral hood and take too much off of the labia, it can look a little top heavy, almost like a micro penis. And so
nobody wants that.
Nobody wants that. So,
well, I mean, some people might want anything, but no. Yeah. I think most women probably don't go for that look.
Yeah. So that's the biggest reason why I do revisions, is because people have gone to somebody that doesn't have extensive training outside of residency in cosmetic gynecology. Maybe they just went to a doctor of, yeah, I do this, and maybe they do it a couple times a year, but it's just not something that surgeon specializes in. So I think finding somebody that has advanced training is really important.
Yeah, I mean, it's a recurrent theme on my podcast, how important it is to really find somebody with a lot of training, somebody you connect with versus, and again, all of these procedures are definitely not the place to price shop, not the place to get a bargain. That's how stuff is going to go wrong. So and you were so kind in letting us know really how extensive your training was. So that's a real eye-opener, I'm sure, for a lot of people as to how it isn't just something that you do on the side. So that is really amazing. Now, one of the sort of hesitations I've read about, seen, or heard is that women may be afraid to have a procedure done down there or in their genital region because they're afraid that they're going to lose sensation. Can you kind of confirm that or bust that myth?
Yeah, I think that's a really common question. And quite honestly, physiologically, it doesn't make sense that that's going to happen because the nerves come up from deep and then come up like this. So when we're taking off the tissue, we're just taking off kind of almost like getting a little haircut. You're just trimming off the edges. And so in the short run, because you might be trimming off the nerves there, you're going to have some decreased sensation in the healing process. But knock on wood, I've never had that as a complication. And physiologically, it doesn't make sense to me that would be a long-term complication because it's pretty impossible to injure the nerve roots, which are deep in the pelvis.
I think that's a really great kind of reassurance for everybody. Again, everything, nothing is with guaranteed, but you're absolutely right. When you know your anatomy, when you know where the nerve comes from, it doesn't come from the outside in, so it, like you said, it should make absolutely no sense, but it's something that I've kind of seen and heard about a lot. So I was hoping you could address that, and thank you. So one of the, so you also do facial aesthetics. You really kind of do like the whole top down kind of thing, face, genital area. Do you do any body contouring? What else do you do? Just those two?
We do non-invasive body contouring with CoolSculpt and Evolve radiofrequency, but we do not do surgery. Body contouring.
Okay. So one of the questions that I've asked a lot of my guests is like, what is your most favorite out of all the procedures that you do to perform? Like, what is the one that you could do all day long and it's your favorite?
I would say, that's tough. I'll have to give you my top three.
Okay.
So I would say, labioplasty, which is usually 95% of the time combined with a clitoral hood reduction, is my absolute favorite because it's just so satisfying. So for me, I love doing surgery. I still love doing hysterectomies and taking ovaries out and doing traditional GYN surgery. So I love doing surgery. So this allows me to still do surgery, but also do aesthetics in one. And so not only is it fulfills my need, and like I said, from a patient standpoint, it's a little different than putting filler in somebody's face. We're like, oh yeah, I'm happy. Is for this kinds of procedures, like women have been like sometimes psychologically like have trauma and PTSD of what past partners have said to them. So it's more than just aesthetics. It's sometimes really helping somebody's self-esteem. So that's probably my favorite thing to do. This is a whole other side topic, but I also love treating lichen sclerosis. That can be just life-changing for people. And let's see, last but not least, I would say I love doing hormone therapy because that also is life-changing for a lot of people.
I love how much of an advocate you really are for like women's complete health, it sounds like. And the more we talk, the more I learn about all the things you specialize in. So your patients are definitely so lucky to have you.
Oh, thanks.
What is your favorite procedure to get? A little bit of a spill the tea here.
Oh gosh. Well, I will be honest, I am not a good patient. Like I have the lowest pain tolerance and like do not like needles, but I would say you just gotta love Botox.
I agree.
It's immediate. Is the best bang for the buck. So I guess maybe because we're having a staff Botox day tomorrow, it's high on my mind, but minimal discomfort, higher reward.
Yes. But I'm sure the fact that you feel that way as a patient probably makes you so good at being empathetic and treating your patient's pain. When I had surgery for the first time, it definitely makes me think differently about what it feels like to be a patient having surgery. So I think all of that stuff really just kind of adds to our experience and how we relate.
Yeah. How about you? What's your favorite?
Seeing that I don't do all the things that you do, my favorite is to do lip filler. I just love the art of it and the fact that it's immediate and, everybody likes a good lip filler. And the same with Botox. I mean, I feel like my face without Botox is not as good as my face with Botox. Yeah. So if I could only pick one, it would definitely be Botox, but thank you for asking. So I love that you shared your expertise with us. Thank you so much. Like I said in my intro back then, Dr. Brenner really does so many things. So why don't you tell people a little bit how they can find you, tell them about your podcast where you discuss great health topics, because I'm sure some of my listeners are interested.
Well, thank you. Certainly, you can find me lots of different ways. My website is dramybrenner.com. I can be found on Facebook at Amy Brenner MD and Associates, also on Instagram, and we have a podcast called HealthiHer.
Yes, it's a wonderful podcast. Please check it out. We will obviously put all of the information in the show notes for everybody to find. And again, thank you so much for your expertise and spending the time to explain cosmetic gynecology to us.
My pleasure. Thanks for having me.
Thank you.
Thank you for listening to the Aesthetic Doctor Podcast with Dr. Judith Borger. We'd love to connect with you outside of the show. Follow Dr. Borger on Instagram at Dr. Borger and find more online and ways to work with Dr. Borger at www.theaestheticdoctor.com. Until next time, be well.